Hi, everyone, and welcome to this episode of Robyn Makes Sense. Tonight, we are going to be covering the topic of heartburn or GERD or acid reflux. And basically, we're going to go through what are some of the issues that what are some of the triggers of heartburn, what can you do for preventative, and then what to do if you are experiencing heartburn and the kind of damage that it can do to your body and why it's something that people should be paying attention to. So the GERD, as I was saying, stands for gastroesophageal reflux disease, and basically your doctor will diagnose you if you are having heartburn more than 2 to 3 times a week, or chronically more like every day, depends. And acid reflux or heartburn feels like a burning in your chest because that's actually what it is. So it's stomach acid that has backed up and is now in your esophagus. So it's actually burning the lining, the muscles in your esophagus, and causing damage. And it's often confused with people having a heart attack. So um, the lower esophageal sphincter is a muscle, and this muscle sits above your stomach, and it kind of is when food goes into your mouth and goes down your throat. There's like a little flap, and this is the sphincter. And when you eat, it kind of opens, food goes down into the stomach, and then it reseals and it closes. So for people that have a weak sphincter, that could be because it's not sealing, so therefore it's not sealing properly, so acid can kind of come back up. Or there could be a number of other things that are going on. It could be certain foods, it could be overeating, and we're going to go through those. But very commonly, people have a weak sphincter. And me personally, I've been dealing with acid reflux for more than half my life. I was diagnosed in my very early 20s, and I was told that I have a weak sphincter. And that this so I've been battling with acid reflux for a very long time, and I know that some of the risks, and I do see a doctor regularly, and I do go for scopings regularly, and I do go for biopsies of the esophagus just to make sure that everything is okay, because when you have GERD and you have acid reflux on a daily basis, pretty much, you do become at high risk for esophageal cancer. So that's something that I watch out for myself. And there are times where the acid can get really bad, depending on. I know that if I ate something wrong or I went to bed too soon, like it. My body tells me this was not okay, and I pay for it for sure. So the acid that's in your stomach helps with the digestive process. We know that we went through a whole digestive process live, and basically it's your esophagus. It does not have the same lining as your stomach. So your stomach has its own lining that protects it because the acid breaks everything down. So it's a stronger lining. So you're not actually burning the inside of your stomach. But when the acid comes up above the sphincter, that area, the esophagus, does not have its own lining. So you are actually burning the skin, the wall of your esophagus, which is why it actually burns so much. And for the squeezing, if you feel like that squeezing on your chest when you're having bad acid reflux, it's because, as we know, your body's way of healing something is by sending oxygenated blood to the area. So if you're feeling that squeezing, it's because your body's sending a rash of blood to that area to heal the area. So you're getting like that squeezing effect. Once the For people that have weak sphincter, oftentimes in women, it means that you have, estrogen weakens the muscle. So if you have a lot of estrogen, you may find that you do have acid reflux. Um, Another thing is soy mimics estrogen. So in a lot of food products that are out there today, there is soy in them, and that mimics estrogen. So that can also increase and weaken the sphincter. There are certain things that you can do to strengthen the sphincter. such as breathing exercises. There are also sucking motions. So my doctor, when I first got diagnosed, used to tell me to suck on something because that sucking motion kind of strengthened the muscle, but also do some breathing exercises because that helped strengthen the diaphragm area around and the muscles in the area so that it could help apply the proper pressure to keep it tight. So there are some procedures that they do now that are FDA approved where they'll go down and I've considered it where they'll go down the throat and they do like a shock therapy to the muscle to kind of strengthen it. I just feel like personally, I don't know. I don't personally feel like there's been enough research. So for me to do something like that, I want to make sure that it's going to work before I. That's just me personally, but there are certain procedures that are available to strengthen it. So if you do have acid reflux, what are some of the triggers, right? So, a lot of people can control their acid reflux just by diet alone. Um, caffeine is a huge trigger for acid reflux. And that's coffee, that's tea, that's chocolate, dark chocolate especially because that has a higher level of caffeine than milk chocolate. And I don't think white chocolate has any caffeine in it, but it has sugar, which is another trigger. Um, even decaf coffee and even decaf coffee is very acidic. So whether it's regular coffee or decaf coffee, that is still a trigger for acid reflux. With tea, you can get a lower or no caffeine tea that would be okay. Like a lot of these herbal teas, a white tea that have very little or no caffeine in them would work better for you. You can certainly look for ones that are on the market. Smoking is a trigger. Absolutely, smoking is a trigger. Um, that's actually how I got diagnosed. Was somebody I was with was having a cigarette, and I thought I was having a heart attack. I hadn't eaten or anything. It's just this person was having a cigarette, and I guess it was just a trigger for me at that moment. And I thought I was having a heart attack. So I wound up going to the doctor and finding out that it was just acid reflux and that the person having the cigarette near me was the trigger for me. But I swore that I was having a heart attack and I was young. I was in my early 20s. So, for me, I was like, I can't be having a heart attack, but I wasn't. It was an acid reflux trigger. And that's what led me to get my diagnosis. Cause then from there I went for the scoping and the scoping is they just put they put you to sleep and they put a camera down your throat and they kind of do a search and make sure everything's okay in your esophagus and the lining and they go down and they just check everything out with a camera. It's an outpatient procedure. Usually you go in, you're out. If you feel that you do have acid reflux or you having any sort of, esophageal issues, going to a gastroenterologist would be someone that you would go to get this diagnosed from them. And they would probably do a scoping. So, um, some other triggers. Sugar is a big trigger. I am like that's probably my weakness is because I do like sugar. I do like sweets. And I know that when I eat too much sugar, my chest is pounding because I'm having bad acid reflux. Tomatoes. Now, tomato sauce, tomato paste, things like ketchup, that is a trigger, but tomatoes, actual fresh tomatoes themselves, are not as much of a trigger. You can get away with fresh tomatoes. They're not as acidic as the paste and the sauces are. So, and most people get away and don't really have an issue with them. Um, Spicy foods. Oh my God, I cannot eat anything spicy. I will be dying at night. Like, forget it. Things that are very high in fat, like very greasy, fried foods, all of this is a trigger. Onions. I love onions. Garlic. I love garlic. I mean, these are foods that, you know, I'm Italian. So for me, onions, garlic, like sauces, like this is a problem when you have acid reflux, right? So one of the things that I do is I'll eat it earlier in the day because if it's close at night, they'll bother me even more. Oranges are very acidic. Pineapples, I love pineapples, but they kill me. They are such a huge trigger for acid reflux. Like it's almost instantaneous when I have a pineapple. I can't. Um, mustard is another one, and a peppermint. any sort of peppermint teas, peppermint gums. The peppermint is a trigger to it. And what I mean by trigger, as far as it tells your body to create more acid, or it's a very acidic item. So you're creating more acid by having these items. That's what I mean by trigger, and therefore the likelihood of the acid coming up is going to be greater. Some of the drinks, alcohol. Now, certain things like red wine has less acidity than white wine. So, if you have acid reflux, stick with red and not white, or don't drink at all. White clear alcohols have less acidity than the darker ones, like rums and things like that are dark. Beer is a no, is a trigger. Beer is both carbonated and has and the acidic level in it's very acidic. So beer is not good for people that have acid reflux. Artificial sweeteners can also be a trigger for acid reflux. Carbonated beverages. Now, carbonated beverages are not good for acid reflux, and the major point of that is because carbonated beverages often cause you to burp. So when you burp, if you already have a weak sphincter, it's gonna, you're burping, air's got to come up through that sphincter, like it's got to let it come up, passing up, and it's gonna bring up some of the acid in that burp. So it's gonna cause that burp, to kind of pop in the line in your esophagus, and therefore leaving some of the acid behind. So it's going to cause you to have acid reflux there. What else? Coffee we already discussed. Also, tight-fitting clothing. So if you're wearing something that's a tight-fitting shirt, or even sometimes like a bathing suit, if you're wearing a full bathing suit, or if you're wearing pants that are a little too tight, things that would be around your waist that are going to apply pressure. And the reason why tight-fitting clothing is because if you're squishing things in and you already have a weak space and it's being squished in, you're gonna offset it. So that's why tight fitting clothing could cause acid reflux. Unchewed food or eating too much food, basically. So if you eat a lot of food and you didn't chew it properly, the job of your esophagus is it's a muscle, so it's squeezing the food to go down and down and down, to go through the sphincter, through the little trap door, to go into your stomach. You eat too much and it's kind of all backed up. Well, now that little trap door is staying open because it's trying to shove food down there, and it can't reseal till everything's down. So acid's going to creep its way back up. So overeating can cause it. And if you don't chew your food well and something kind of gets stuck in that trapdoor, leaving it open, that too can allow food to come up. Laying down after you're eating. This is a huge one. If you eat and you go to bed at night, I cannot eat before I go to bed. And there are times it depends on I have to pay attention to how many hours I eat before I go to bed, because if I go to bed, it just literally comes up. There have been nights where I would wake up choking because it came up and went down into my windpipe, and I actually, started to choke on it because it went down into my lungs and, caused asphyxiation. So you can actually choke on it. There were times that I had acid literally come out through my nose while I'm sleeping. It's disgusting, I know, but this is all what happens when you have really bad acid reflux and you don't realize it. Or you do realize it, and it's causing problems. So laying down, being overweight is another thing. So being overweight decreases the pressure holding the sphincter closed. So because your organs, everything is supposed to fit in a certain way. So by being overweight, you're putting pressure in certain areas, therefore it's decreasing this pressure. And, often people that are overweight have a, hernia, a hiatal hernia. So that all plays a role in the sphincter and having it seal properly. So the other trigger is medications, certain medications, and if they're breaking down in your esophagus, that can cause that burning as well. Things like ibuprofen, which is Advil or Motrin, NSAIDs, which are Aleve or aspirin. So when you take medications, especially over the counter ones, you want to look for ones that have a coating on them. A lot of these don't, but if you have a coating on it, it kind of helps so that by the time it goes down, the coating may have worn off in your esophagus, which is not going to cause the burn. But by the time it gets into your stomach, that would be where you want it to break down, not in your esophagus, because that will cause irritation and burn. Now, what are some things that you can do? Well, let's discuss what happens when you have acid reflux, right? When you have it, what can you do immediately? So now you have acid reflux. There are over-the-counter medications, things like Tums and Prilosec. There's so many over-the-counter medications that you could take that help it. Some work fast, some don't work fast. Some are 12 hours. I mean, depends. Figuring out what works for you. Although you don't want to rely on these medications for the rest of your life. You don't want to be on these medications living on them, because any unnatural thing that you're putting in your body with any medications, you want to your body's not used to these kinds of medications. So when they break down, there's always effects to everything. So know what you're putting in your body and how long you're putting it in your body. And if you feel like you have GERD or you feel like you have heartburn a lot, talk to your doctor, go get tested and see what can you do, because there are medications that they can give you to reduce the amount of acid that your body produces, which is something that I'm on. It reduces the amount, so there's less acid to come up. But again, that also has its downsides to it in the long run, as far as breaking down foods and things like that. It interferes with the digestive process. So if you do have acid reflux, and one of the things that I love and that I use is medical grade Manuka honey. So that both coats the esophagus, if you have a burn. If you do have heartburn, and if I take the medical grade Manuka honey, it immediately takes it away. It immediately um, coats my esophagus so that I'm not getting that burn anymore. It has like a pH balance that it somewhat neutralizes the acid, but it also protects my esophagus from any damage. So at night, I'll take a spoonful of Manuka honey, probably about an hour before I go to bed. And especially if I know that I ate late or ate something that's going to bother me, I don't do it every night. I pretty much just judge on whether or not I think I'm going to have a bad night with acid reflux. Because when you lay down, there are nights that you don't get any sleep because you'll be choking all night. Um, so basically, I'll just take a spoonful, like a teaspoonful of the honey, swallow it. It's very, very sweet and it's very, very thick. If you could also take it with a glass of water, but if you're using it to protect you from acid, I would just take it straight up, because that thickness is what you want to protect you from the acid that's going to be hitting the lining of your stomach. So that thickness will protect that coating, because the acid will take a while before it gets through that. It most likely will be gone by the time it gets through it, and it helps a lot. And it heals your esophagus if there is anything going on. So medical grade Manuka honey. Milk, I often take milk. If I'm somewhere where I'm out and I'm having an acid reflux attack, I will ask somebody for, a small amount of milk. Milk neutralizes acids in general. The thing with milk is it's a very short-term solution. So if you have acid reflux and you take a little, a small glass of milk to neutralize it and to coat your esophagus, because that will coat it as well, that's great. But that milk will eventually turn into sugars, and that will, especially if it's whole milk, it'll turn into like the sugars and the fats, and that will cause you to have more acid once that's breaking down in your stomach. So it's kind of like, if you desperately need it, have the milk, but know that it's going to come back later, because you're creating more acid in your stomach in the longer term with the milk. Apple cider vinegar. This is something I have not tried, but I know so many people that swear by it. I just don't like the taste of apple cider vinegar. I just don't drink it. I know that they have pills and gummies now that have apple cider vinegar in it. That's supposed to help with acid reflux. I've not tried those, but I know so many people that have and swear by them. Chewing gum. Chewing gum helps with acid, because it help as you're chewing gum, the saliva, you're getting saliva which is going down, and it kind of pushes the acid down and pushes it back into your stomach. It's it's the same premise as if you're drinking water. Although for me, when I drink water, I feel like my acid is worse. But medically speaking, every doctor has told me that if I drink water, it should be better. But me personally, it does not work. For me, it's worse. Um, there are some people that drink water and it's better because it kind of lessens the acid or cuts the acid. For me, it's worse. So know your body and know what works for you. Um, oatmeal is good for acid, especially if you're having acid attack because it absorbs the acid. So having some oatmeal on hand, I'm not talking about the sugary oatmeal bars. I'm talking about straight up oatmeal that you make with the Quaker Oats kind of oatmeal in a pot that's bland and, bland. Maybe put a little honey on there as well. But basically, oatmeal absorbs the acid, so that will help with it as well. Um, apples neutralize the acid. They create like an alkaline environment in your stomach. So if you have an apple, and apples are actually very good for you on many different, they're good. They have probiotic, they have fiber in it. They have, I believe it's prebiotics in them. So apples are good for you. And now they also create an alkaline um, environment in your stomach for your acid. So why not have an apple a day, right? They say an apple a day keeps the doctor away. Okay, so those are some of the what to do if you have an acid attack and burning and um, also one way if you think you're having a heart attack and it's really acid reflux, if you do one of these like quick methods that should help rather quickly, you'll know if it goes away. If you took a spoonful of honey and in 5 minutes that pain went away, it wasn't a heart attack. It was your acid reflux. A heart attack wouldn't go away by taking a glass of milk or Tums or, honey or oatmeal or anything like this because the pain, one would have nothing to do with the other. So that's also another. If you think you're having some sort of chest pains, do one of these measures. See if it could be something more serious as well. Don't leave yourself in pain, and certainly don't leave your esophagus just burning like that. Because it's basically like you're pouring acid on your skin, on your esophagus. That's really what it is. It's acid. So, would you pour acid on your skin and leave it? No, you'd wash it, you'd clean it, you'd bandage it up, you'd take care of it. So, take care of your esophagus. And I say this to myself too. So, um, you know, I've become a pro with acid reflux. I've learned a lot over the years. Now, what are some ways that you can prevent getting regular acid reflux attacks? Um, Wait 2 to 3 hours after eating before lying down. Don't go to bed right away. Don't eat a big, huge meal and then go lay in your bed. You will pay for it. The burning will get worse, not better. Wait 2 to 3 hours so that you know that everything is passed down into your stomach. It's all going down because food, even if it's sitting in your stomach, being broken down and still going through that process, the acid is still in there. You want to make sure that it's all gone and down into your intestines so that there's not a lot of acid floating around in there. So when you lay down, it's not going to come right up, especially if you have a weak sphincter. Eat slowly. If you eat slowly, the food won't get backed up into your esophagus and won't cause, like it won't cause a backup. Like the food will, if you eat slow and you chew really well, the food will just go down normally the way it's supposed to. When you inhale food, you're gonna have acid reflux. That's just the way it works. Um, Avoid triggers. We talked about some of the triggers today. Do your best to avoid them. If you know that you had it, like I know that if there's a day on a Sunday, if I had sauce that was heavy in garlic, I'm gonna have a spoonful of honey that night before I go to bed because I know that that is going to be a trigger for me. I'll eat certain things that I know that will bother me. If I'm at somewhere and I want to have a drink, I'll go to lunch and have a drink because, for me, drinking at night and then it doesn't work for me. If I'm on vacation, if I'm out by a pool or a lounge, I'll drink during the day. Night drinking, I will be in so much pain at night. So just learning to change certain things and knowing what works. It's not that you can't ever have sugar or chocolate or, alcohol or things like that. Just know how to work the system essentially. Know when if it's close to going to bed, stay away from the triggers. and just manage them in a way that it's during the day so that you know you're not going to bed for a few hours, so you know it's going to pass through your system. Don't take a nap right after you eat lunch either. Like, do not go to sleep right after you eat. That's a huge no-no. Okay, when you go to sleep, sleep elevated. I actually sleep. I have a wedge pillow. I actually bought myself last year as a Christmas gift to myself one of those Medcline pillows that has it's got a hole in it, so because I'm a side sleeper, so if you sleep on your side, your shoulder and your arm can go. Because I used to sleep with a wedge pillow, and I'd wake up all stiff, and or trying to sleep on my side, I'd have severe stiff necks. So with the wedge pillow, it allows me to sleep on my side a little bit better. And I have to say that, you know, since I've been using that pillow, I when I lay down, I'm not having as much of an issue as I did before that pillow. I used to have a lot more of an issue, certainly laying flat. So once I started using a wedge pillow, whether it's that Medcline one or, they have some other generic ones that are just wedge pillows, all of that helped. Um, if you have one of those beds that can adjust slightly, and you're not sleeping on a huge, it's not like you're sleeping upright. It's just a slight up, and you can put a couple of pillows behind you, but I don't feel like you get the same. You'll hurt your back eventually if you just do like pile up some pillows, because it's gotta be an incline so that your back is not in an odd position. So, they have some inexpensive ones that you can certainly get um, to sleep slightly elevated. And for me, this is a huge one. Lay on your left side. So I did a video about the benefits of sleeping on your left side. If you eat too much food, sleeping on your left side, if you're having acid reflux, sleep on your left side, because the way that your anatomy works, your stomach is to your left side, and the way that it kind of angles, if you sleep to your left, it keeps the acid away from the top where the sphincter is. So when you sleep to your left, the acid will still be in there, but it keeps it on an angle so that it's not affecting you. If you sleep to your right, it's the opposite. So now it's kind of like going over, and you would most likely get acid reflux because it the way that it's positioned, you don't have as much room on that top. So I would need to show you a graphic. Sleep on your left. Try it. See how it works. Sleeping on your left also reduces your blood pressure. It also helps with the toxins in your body, because your lymphatic system flows to your left, and gravity pulls things down. So it actually helps reduce your likelihoods of having certain breast cancer, because it's the lymphatic system that's right there on your left goes that way. And there's a lot of health benefits to sleeping on your left. If you didn't watch that video, go watch it. We also have it on the app, so you can certainly look, the benefits of sleeping on your left side. Okay, so don't jump around or exercise after you're eating. Just like when you had a newborn baby, right? If you've ever held or fed a newborn baby and you feed them, and then what do they tell you not to do? Don't shake the baby after the baby eats, because it's going to come right back up. And that's the same premise here. Not that you're going to throw up, but just that the food is going to come back up into your esophagus, and therefore bringing all the acid with it. So if you're jumping around, don't exercise right after you eat at all. Bending down a lot after you eat, just let the food digest for a few minutes. Let it sit, let it go down its path, and then do what you need to do. Give yourself like a good hour before you start, crawling around and bending over and getting very active, so that the food kind of goes down, and you're not dealing with massive backup of acid. Medications to reduce the acid in your stomach. This is something that I take, and this is not always something for everyone. You need to speak with your doctor. You should absolutely speak with your doctor, because there are ups and downs with, pros and cons with taking medicine that reduces the amount of acid in your stomach. If you have way, so if you're somebody that produces way too much acid, then something like this would benefit you. If you don't produce enough acid, then your digestive system can't function properly, and that can cause other issues along the way. And we know how important gut health is to your brain, to your body, to the functions of your body. So you don't want to just make decisions on your own without getting proper diagnosis and proper guidance from your medical professional for sure. If you have questions, you can certainly ask, your gastroenterologist, or go see one if you think that you have GERD. Um, strengthening the sphincter is also a way to is also a preventative measure. And they have breathing exercises, and mainly with the strengthening with the breathing exercises, you want to expand your lungs as much as possible. Now, this is something that I recommend people do on a regular basis anyway, because it reduces your blood pressure. It helps calm your mind, your anxiety. You know, you're getting full oxygen in, and you're expanding your lungs, so you're you're it does not hurt you to have more oxygen in your body, right? Like, that's something that you need, is oxygenated blood that goes throughout your body. So if you have more oxygen, that's a good thing. So doing breathing exercises doesn't have a negative effect. It actually has a lot of positive effects. Um, and I highly recommend it. I tell people to do the what I call the count of four. So you take a deep breath in, counting 1, 2, 3, 4. Hold it for 4. 1, 2, 3, 4, and then out for the count of 4. So 1, 2, 3, 4, and like fully expand out, and then take another deep breath in and hold it. Like, and this is, and when you do that, you'll actually feel your heart beat a little bit faster, because it's getting oxygen, and it's like, wow, this is exciting. We're getting more oxygen. Like, this is good. And your heart will beat a little bit faster because it's pumping, it's working a little bit better, it's getting more oxygen. So that's a good thing. And you'll find that if I tell people to do that 10 times in a row, and to do that like in the morning, do that in the evening before you go to bed, it helps a little bit better restful sleep, because it calms your mind, it calms your anxieties. And in the morning, it's a good way to start your day. It's a good way to just clear your mind. It's a good way to, why not get a lot of oxygen in your body in the morning? It's a good way to just, you know, let's start the day breathing well and strong, and taking deep breaths. So that's a way to exercise your sphincter and to make it stronger, and also makes your diaphragm stronger, and good benefits. So that is my uh, information on acid reflux. And I have gone through so much with acid reflux. So please, by all means, ask your comment. If you ask your questions, I'm here to help. Absolutely.